for tuning in to the HR Uprising podcast. I'm your host, Lucinda Carney. The HR Uprising is focused on helping forward-thinking people professionals deliver real lasting value in their organisations. I'm a chartered psychologist, speaker and trainer, and recently authored the best-selling business book, How to Be a Change Superhero. My day job is founder and CEO of software and training business Actus. This gives me the opportunity to work with other businesses like yours. We are focused on building a better workplace for people wherever they are located, with the help of our performance, learning and talent management software and our training and consultancy services. Every week on the podcast, I will be covering different topics and challenges, joined by relevant experts and real-life people professionals. Thank you so much for tuning in. I really hope you enjoy and get value from this week's episode. Hello and welcome to this week's HR Uprising podcast. And this week, we've got a really important topic to learn about. I'm really honoured to have Dr. Liz O'Riordan and Barbara Wilson to join me today, and we're going to talk about working with cancer. So thank you both of you for joining today, and I'm going to just hand to you to introduce yourselves because you've both got very powerful backgrounds before we go into the meat of the episode. Liz, do you want to go first?
Yeah, so I was a breast cancer surgeon who got breast cancer twice. And I was off for a year with chemotherapy, mastectomy, radiotherapy. And when I went to go back to work, my line manager told me that I was only allowed a month to return to full-time work because that was the policy. And I thought, I get that, but I've had my own cancer. I've been off for a year. I can't get back to full-time work in a month if I ever get back. And that led me to a lot of soul searching and desperation on the internet. And that's when I discovered that in the UK, I was legally disabled and I had rights. And I found Barbara through working with cancer, who gave me the power to say, this is what I am entitled to. And she coached me to help me cope with going back to work and dealing with questions I might get as a cancer patient. And I wouldn't have gone back to work without her. And that's why I'm now an ambassador for workingwithcancer.co.uk.
And so we'll come back and find out more about what that is. But so Liz, did you work for the NHS?
Yeah, I was a consultant breast surgeon in the NHS and I got breast cancer at the age of 40.
So their policies didn't recognise that you were legally...
I think most medical directors, HR line managers aren't aware that you are legally disabled and have rights. And the standard policy after sick leave is a month of phased working to return to full-time work.
Right, gosh. And Barbara, would you like to introduce your background?
Yeah, I was diagnosed with breast cancer in 2005 while I was working as an HR director in the city, and found it incredibly difficult getting back to work. I think most people had decided I wasn't going to come back, and I had a really tough time. So that led me in 2006 to set up a kind of campaign group, which I actually called Working with Cancer. And to cut a very long story short, I set up Working with Cancer as a company. It's a social enterprise, not for profit, and staffed by people who've had cancer or had a profound experience of cancer as carers. And we work throughout the UK and Europe supporting anyone affected by cancer at any stage, any diagnosis, to manage work, return to work or find work. So that's what we do.
And it's actually very inspirational that you're both joining you today looking so healthy and well. So it's a real positive to see that people can come back and be contributing. And I guess that's one of the things you want to inspire people to do and organisations to do, to recognise in terms of having skills back in the workplace that aren't lost. So,
and I think off that, I would say we could all have metastatic cancer. We could all have incurable cancer, but you cannot tell. And that's what ending the stigma is. You can't spot a cancer patient. We don't look like you see the images in cinemas, with hospices and things. So it's kind of forgetting that anybody could have cancer.
At any point in time. So they could be living the cancer is what you're saying. There's no reason why they couldn't be contributing. So
exactly.
So Barbara, you set up the Working with Cancer organisation, and this is a Working with Cancer campaign that you've been highlighting recently, and also some surveys. Do you want to tell me a little bit more about the campaign and why it's so relevant for anyone listening in HR or businesses overall?
Okay, well, I'll try and keep this relatively brief. As you may know, 1 in 2 of us will be diagnosed with cancer in our lifetime, which is, a big number, half the population. Most people don't realize that. But also more and more of us are surviving cancer and want to return to work because it's part of our life, which is important to us. Now, this is an issue that's becoming increasingly important. 1,000 people are diagnosed with cancer every day. There's something like 2.5 to 3 million people living with cancer here in the UK alone. About 1 million of people of working age. So they're big numbers. The cost to the UK economy of not having people at work was something like, this was a few years ago, £7 billion a year. Okay, so they're big numbers. Now, this is Liz and I and others have been involved with trying to get employers to understand the issues and challenges of having people working with cancer, the need to get people back to work for some time. But then in April last year, Arthur Sadoun, who's the chief executive of the Publicis Group, head office in France, but big global company, he was diagnosed with throat cancer. And when he went public on his illness, which frankly not many chief executives do, let's be clear, for a whole variety of reasons, he was overwhelmed with a kind of mailbag of people basically saying, we don't like talking about our cancer because of the fear of what's going to happen to us and our career will be severely damaged. And that kind of led him on a mission, basically, along with the group as a whole, to try and get organizations globally to both understand the challenges of managing work in cancer, but to provide transparent reports to people who have cancer and also to working carers. So what he did is he launched at Davos on the 17th of January, this campaign to get international companies. The campaign focuses in the US, France, and the UK, but to basically sign a pledge committing to improve the working conditions of people who have a diagnosis of cancer or are cancer carers. And so far, hundreds of large organizations have signed up, people like Adobe, Google, L'Oreal, Meta, Lloyd's. I think lots and lots of big companies. And they're each now either putting together a program to support people with cancer, or they have one in place, which they'll make more transparent to their employees. As far as the Publicis Group is concerned, they've come up with 4 kind of principles for their employees. One is that they're going to secure the job salary level, the benefits, the pay generally, the careers of people within Publicis who have a diagnosis of cancer for at least a year. Okay, so they can basically not worry about their job and focus on getting better. They're going to support people once they return to work with kind of personalized career support. They're going to give Publicis Group employees access to peer level support within the organization. And then anyone who's in a primary caregiver role at Publicis, they will get, again, customized professional and personal support, so they can, as it will, have the flexibility to kind of cope with their job, but also to support a loved one. So this is a massive campaign, a really important campaign. And we're delighted, I have to say, Liz and I and my colleagues at Working with Cancer, to be an integral part of the campaign here in the UK.
And that's really helpful, because what you've identified there is, I guess, a practical steps, and we can come back to that a little bit more later, that others can learn from. It's all very well pledging to something, but actually, what do we really do about it? And Barbara, just because you've got the HR background, I'm intrigued, really. What do any companies at the moment have anything? I'm assuming, is this a new policy, or from an HR point of view, how is the pledge turned into something real, and what is the normal status quo, would you say, in the UK in terms of how we approach this sort of thing?
The normal status quo is very patchy. Some organizations can have great policies, some have no policies. Some organizations have great policies, but in practice the policies aren't actually implemented locally by the local manager. As Liz hinted at earlier, very few managers or employees understand that they're protected at work by the Equality Act. Very few managers understand their responsibilities. Some HR teams don't understand their responsibilities. Very few of them talk about return to work. So, the pledge is really about trying to get organizations to understand the issues around work in cancer and to have a coherent set of policies about this. Very few organizations, and I've worked for a long time in the city and here in the UK, very few organizations even know, partly because of data protection, how many of their employees have cancer. As an employer, you're not required to tell your employer. Many, as the survey that Publicis did, and we've done surveys too, many people don't like talking about their cancer. They're worried about their job prospects or what will happen to them financially. So most companies don't know how many people have cancer. They won't have a specific cancer policy. They'll provide private health. They'll have an employee assistance program, which typically are very underutilized. They will have return to work policies, but they're often not transparent to the people within the company. So most people, when they talk about their cancer, from their perspective, they won't really know what support the organization will provide.
And I guess, again, are you advocating in terms of this? I said some of this is the pledge is sort of saying it's okay to tell us about this so that people feel protected to share that information.
Absolutely. I think it's really important that organizations state openly, as Publicis have, that they support and will protect the careers of people with cancer in the workplace, because that's the right thing to do, both morally as well as economically. So
and as a patient, often work is the only time where you feel you don't have cancer. You are an individual, you have a purpose. Work is often your escape, and when you're told, oh no, you can't have that, it can be crippling.
Yeah, in terms of your mental sort of sense of purpose and not having to think about being the ill person. Yeah. I mean, there's other areas where you think about returning mothers and things like that. Whole sort of being able to, it's your identity, it might well be your work person if that's your profession.
Absolutely. I think it's really important, and I think it's a really critical issue. I remember when I was returning to work, yes, it's a part of your identity. You don't want to be the person with cancer. The doctors never ask you about your life outside of being a cancer patient. And when you go back to work, typically people don't know what to say. They don't know what to do and when. And classically, some managers will say, well, I didn't want to upset them, so I won't say anything.
Yeah. And it's the elephant in the room, isn't it, really? That's it. I mean, I think it's very important with cancer. It's more frequent. I've got an example how one of my close friends, her husband had a massive stroke, at 50, and that was a huge impact. Now she's the carer for that, and she had to take extensive amount of time off to do that. So they're very life-changing events with a major illness like that sort of thing. And she was lucky because she was a partner in a business and was able to get support, but that was ad hoc as opposed to being something which you would know that you could go and ask and request for. So I guess I'd like to know a bit, we'll come into some of the data and the survey, Barbara, but actually I'd just like to go to Liz for a bit to understand a little bit about that whole experience of being, and almost the huge weird thing that you had, this thing where you've been the person dealing with people as the doctor having it, and then being the patient. And could you explain a bit about what's going on in people's heads in terms of at this time, and in terms of both the worker and I suppose the patient, so we can understand it better?
Yeah, I think when you're told you have cancer, every common sense thought just leaves your head, and you are busy processing with I've got cancer and the potential logistics. Am I going to die? What's going to happen? Meanwhile, the doctor is giving you all this information and you're just going, I've got cancer. And then you have to go home and tell your family what the doctor said, and you can't remember, and suddenly you're having to be the doctor. And your life, you kind of go on a roller coaster, just going through treatment, and hopefully you've got a family and friends to help you. And for a lot of people, say with breast cancer, they can have an operation as a day case. They have radiotherapy that they can work through. They don't lose the hair. No one knows they have had anything done. They may only have 2 weeks of work, just, a gynae op, you could say. But you've still got all that huge mental toll and anguish. And you may feel you've not had a proper cancer because no one can see. Yeah. Whereas if you had chemotherapy, you're off for a year. If no one knows at work what's going on, when you go back, Why have you been off? What's wrong with you? What's been going on? What do we say? And I was treated in a different hospital, but when I went back, although I'd been blogging and talking about my cancer, most of my colleagues had no idea what had happened. And I was prepared for kind of dealing with patients, but I wasn't prepared for my colleagues' reactions. And when you are talking about cancer patients and you know a doctor's had cancer, it can be very hard to talk openly about a patient. One of the first patients back we discussed had my cancer, and I had everyone in the room go, "Oh my God, that's awful." They couldn't know they were talking about me, but inside I'm going, "Oh, I can't cope with this." So how do you support a team of people who are interacting with someone with cancer? Because it's not just the cancer patient that needs help. And Barbara was saying things like, what do you want them to know? Do you want to send a round robin saying, I've been off with this, I do not want to talk about it at work, I'm here? Or do you come up with a lie? Are you worried your line manager is going to gossip and everyone's talking about you? People think you can't do your job properly, especially when chemotherapy affects how you think. The menopause can affect how you think. I can't multitask, I'm slower. I don't want people to think I can't do my job. There is so much that goes on, along with dealing with the physical and mental side effects of cancer treatment.
Yeah, the actual fear of your mortality.
The fear of it coming back, the chronic pain, the loss of body image, problems you may have from money. If you can't work through chemo, then you don't have that income coming in. And how much of that do you show at work? Or do you have to put on a brave face and say, no, I'm fine? And then where do you go when you're having a wobble? It can be really, really hard.
It's really tricky. And thinking also from a line manager point of view, I think of from a friend's point of view, where I've everybody deals with grief, for example, differently in my experience. And so one person say this would be a similar sort of thing you're having. There is a sort of sense of grief, I imagine, in terms of the experience, but some people might want to talk about it and some people might not want to talk about it. So it's interesting to work out what the right tools or what's the right approach for organizations or line managers to, I mean, I guess the answer is to talk to the individual, right? But
it's the most difficult thing, that talking about cancer is the most difficult thing. And what's often the problem is that people don't talk about it at an early stage, and then it becomes even more difficult because we discussed it before. And so, one of the significant pieces of advice we give employers is, as soon as you're aware someone's got a cancer diagnosis or they're a carer, sit them down in a private room, ask them how they are, listen, and then at an appropriate point in the conversation, show empathy and say, okay, what can we do to support you? Who do you want to tell? Who do you want to tell about this? It would be helpful to tell some people, or maybe just HR, but have those early conversations, and then it becomes so much easier. When you don't talk about these things, often the problem is bigger and bigger and bigger.
And I think whoever you're talking to let the patient know, or person living with cancer, because we're people, that conversation is confidential.
Confidential, yeah.
And they'll say, but I have to tell these people to make sure that if you need reasonable adjustments, you need time off to go to appointments, you need early toilet breaks if you have a stoma that needs changing, questions aren't going to be asked by those higher up. This doesn't go any further, but how can we help if you do want to talk to other people? Because people are scared of it becoming gossip.
Yeah.
And a lot of people do not want anyone to know apart from their line manager, because they want to move on. They want to forget about it.
Yeah. I had just a quick anecdote. I was coaching somebody who was quite senior in an organization who had a cancer diagnosis and wanted to keep it absolutely private. And so she just told her manager, and that was fine, and nobody else knew. And about a year after her diagnosis, there was a huge global conference in the States that the whole company went to, about 2,000 employees. And the chief executive stands up and he says, it's lovely to see you all here today and have you all here together. And I'd particularly like to thank X, who is just recovered from cancer treatment. Okay. So, ouch. It's really important to understand and maintain confidentiality.
It's an interesting, I mean, absolutely, you've got to respect people's confidentiality, but it's also an interesting one where I'm just thinking, if I'm a line manager or HR, where I actually sort of saying, what can I have permission to say? It's almost, what is the line? Because people will notice if someone's off, people and then they might they gossip, or they think that the person isn't effective. They judge them for not pulling their weight. So I think,
and we're all nosy and curious.
Yeah,
I think you have to say, it's not my duty to say.
And you agree with the person what you can say.
I think that's the thing,
and you get that in writing.
What they want the story. What when you're off, which we know is fine, but what would you like us to
exactly
and actually get them to think about it early. When you come back, if you don't want people to know, we need to come up with a white lie, a sentence they can easily say to explain your absence.
It's not difficult, actually.
No,
but you need to have that conversation.
And I think there's something here, though, when we're talking about that conversation, and I guess this loops in, it needs to be the line manager and HR probably working in conjunction, because HR need to support the line manager in terms of what's the right thing, and there's a sort of a two-prong piece there. Again, I suppose from an HR point of view, Barbara, is there anything that you say that HR could do? Is it maybe coach the line managers, or any other thoughts? Because you're obviously coaching people anyway. What thoughts have you got there?
I think definitely support the line manager. And I think there are 4 key points where HR and the line manager need to have what I call a kind of relatively, a caring but a structured conversation with the individual. One is at the point of diagnosis. Secondly, when they're about to start active treatment. Then when sort of a few weeks before that person comes back to work. And then once they're back at work, to have regular conversations. And I think obviously important to keep in touch while someone's off having treatment. But HR can play a really important role in guiding and working with the line manager, but not necessarily, now this sounds, not necessarily playing it by the book. I think the issue with cancer is that recovery from cancer is not linear, Lucinda. So what happens is you have good patches and bad patches. Typically after about 8 to 12 weeks, people hit a plateau of fatigue and other side effects from treatment. Often side effects don't begin after treatment's finished, and often result from the medication you're on.
And then the dips for the yearly scans and the yearly follow-ups. And you may have 2 people with prostate cancer, one who is a wreck and one who sails through. So you can't compare, but John was fine. I'm not John.
Or classically a line manager will say, well, I know about breast cancer, my mum had breast cancer, or everyone is different. So it's important that the HR person gets across to the manager those things. Don't make comparisons. Recovery is not linear. People will need a long time. Typically most people take at least a year to recover properly
after chemotherapy.
And that of course doesn't allow for things like potentially recurrence or further surgery, reconstruction, or other stuff after, say, breast cancer that's often needed. So HR can be really good in providing that guidance and information for managers, so they understand what they're dealing with, because most managers are really busy. They just want that person back at work. And typically they'll say, look, when are they going to be back again? Why are they still off sick after 8 weeks or whatever it is? So sometimes it's just filling those information gaps can be unbelievably helpful. And if
helping
do that, no one will.
Helping carry on that person's work whilst they're off. I was very lucky in the end that the locum doctor doing my work, was allowed to stay on for 3 months whilst I found my feet again. So you're not suddenly back up to full speed. And I think HR can help the line manager manage the business, so the person coming back doesn't feel that responsibility, that onus. We need you, because that just leads to all sorts of trouble.
And almost creative solutions as well, because your other point was, as you're expected to go from 0 back to 100% within a month, which is maybe are the ways that we can bring this person back a couple of days a week, or just gradually bring it back in to make it manageable and achievable.
That people are entitled to reasonable adjustments for as long as is reasonable. Frankly, for more than 4 weeks, 4 weeks is not reasonable.
No, 3 or 4, even 6 months. Because the more you do, the more tired you get, because you're doing more. So you almost need a break when you add on that extra day. I'm really, really tired. Okay, now I've got used to working 3 days a week. We go up to 4. That'll be exhausting. It's like a roller coaster.
So We've talked about so the personal experience of it and how HR and managers can work together, and there's an individual experience about the individual. If we were going to go back a little bit wider, because I know you've also done a survey, so you've got some wider stats out there as sort of facts and figures, which might be useful just to share some of those with our audience, so we know what the situation is more generally.
Yeah, sure. Well, Publicis did a survey. I mean, we've done them too, but Publicis did one quite recently, just at the end of last year. It was about 1,000 workers here in the UK, and that showed that despite all the protections we have here in the UK to protect people with cancer, 71% of that population, so that's what 710 people basically, said they were fearful of telling anyone or their colleagues about their diagnosis, and of that 71%, almost half feared telling their colleagues because they were worried about losing their job. And that's because they didn't know actually they're protected here in the UK by the Equality Act, but that's a hell of a number. Nearly half said that they were, 46%, that's the number, said they were concerned about the financial impact of having cancer should they take sick leave or stop working. And 46% of respondents said that they continued working because they were worried about financial pressures despite their poor health. Now, the interesting thing is just that those are real concerns, clearly, but those people who were actually supported by their organizations in the end, as it were, almost 90% of them said they actually did get a lot of support from their colleagues and from their employer. So that's brilliant, okay? But the issue is they didn't know the support that their employer provided. They didn't know about it because organizations are not brilliant at talking about the support they provide for people with cancer. They will talk about mental health these days. I'm afraid to say cancer, controversial point in it, cancer's become a bit unfashionable, okay? Resilience, mindfulness, mental health, they're the things that tick the boxes. Cancer somehow, cancer policies, people don't have them. And I think really good organizations could do so much more to talk about cancer openly and the support they provide their employees, because it's quite clear that people at the moment are really, really scared about not getting the support they need, which is why, those numbers that from the Publicis survey emerged. 71% were fearful of telling their colleagues they had cancer. That's a very big number.
And this is interesting because actually your point about mental health and also menopause, those are topics now which it's all, they're trying to be destigmatized, but actually the number of people with cancer in the workplace, it's up there, if not higher, in terms of likelihood of it, isn't it? So that's fascinating. And some of that, I wonder, is it because everyone's a bit scared of, it is a bit of almost a fearful topic for people generally?
I think I did a thing on Instagram about this, and so many people replied saying they were forced to retire. They were pushed to retire. They were made to feel they could no longer do their job. And these are women in their 30s and 40s having had cancer. They are scared that they won't be able to work full time, and they're not needed part time, so they'll be told to leave. So they don't tell, and they carry on, and they push, and they get sick. They're scared about losing their jobs or being pushed out or not being promoted. Because you've got cancer, you might die.
The other one, Liz, and there was some legislation, I think, passed in the UK recently about this, is the classic one around redundancy. I think a law went through Parliament recently about maternity leavers can't be made redundant until sort of 18 months after they come back. I know of lots of cases of women in particular who come back to work after cancer and their boss says, it's lovely seeing you back. Actually, while you've been away, we've been restructuring and your job no longer exists.
Well, I mean, I think they'd have a case there, right, in terms of that.
But cancer patients are going through cancer treatment. You'd be amazed how many people do not know they have rights, they are legally disabled. They don't have the energy to fight it because they're trying to cope with cancer. Yeah. And they just go for the quiet life.
Yeah. And redundancies can be genuine. Employers, I've worked in HR. Redundancy, you can make a redundancy look genuine even when it is. Okay.
Indeed. So it's about advocating then, isn't it? Because actually it could happen to anybody, anyone listening to this, it could be touched by this, and being, overt and making sure that, cancer and, to say, stroke or other real life, these sort of illnesses should be, people should be fully supported in this, and destigmatized. So as you say, rather than it's become a little bit unfashionable, trying to help people so much more. In terms of, I guess, what good looks like, I think that's probably, I'm quite sure that the sort of people who listen to the HR uprising, they've been in difficult positions where they've had to do redundancies. We all feel a bit scared if we might have to deal with it, but equally we would want to do the best for somebody and to support people, and can see that this is the right thing to do. So what sort of tips have you got for people out there who want to, the pledge, obviously, we'll put all the links to anything useful. I know there's loads of really useful resources that you guys have got, so I'll put links in our show notes there. But if you've got any examples of what good looks like that people could take away with them, that would be really helpful.
Well, good looks like, for a start, having a policy that you support people with cancer and working carers. It might be other chronic conditions as well. It doesn't just have to be cancer, but so the first thing is an open statement, and then transparent policies which say, these are the benefits, the things that we do to support you if you have cancer. Okay. There are best practice guides that we have and other organisations like Macmillan have that ought to be made available to staff. There are training sessions. We provide coaching as well. Peer support groups, publicists are setting them up, are really excellent sources of advice and guidance. So it's not difficult, it really isn't difficult, and it isn't, the return on the investment is really, well justified. So it's just a question of being open and putting these things in place and letting people know that they're there, so that
that's my point.
So that they know they are protected as soon as they have an issue.
If there's a policy in small print on a website, no one's going to know. Almost every new employee, we have a cancer policy. If you're affected or you care for someone, and almost every year remind everybody, open date letter, just to say, if you're affected, we're here, we can help.
So from a practical point of view, from an HR, and I don't actually know the answer to this because I'm more of a learning and development background person. I steer clear of policies, but where most businesses would have a policy, and probably now they've got they may, some of them, the bigger ones, and actually it's interesting because it's interesting to think about what's right for a really small, where you're an HR department of one, whereas you've got like a business of a sub 50 in the large organisations, but they might have a mental health policy. They would obviously have a sickness policy, and a menopause policy. So I suppose what I'm saying is this a subset of your sickness policy, or should you have a mental health and a chronic illness or a cancer? What would you think the right approach is to make it overt?
It's a good question. I mean, I don't care what it is, as long as it's stated that we support people with, these conditions, and you can list mental health, depression, cancer, Parkinson's, MS, that these are all, people these days, we're all living with a whole variety of chronic conditions. Thank God, we're living with them as opposed to not living with them. Absolutely. But I think, it doesn't matter if it's one policies or four policies. I mean, I think very often, publicists themselves have actually putting chronic conditions together. You need to name them because many people won't know what chronic means. Yeah. But I don't think this is rocket science. As long as cancer is covered somewhere.
And you speak it out loud. It's put out there. It's verbalized. It's kind of. I'll tell you what. Actually, I was thinking about it. It fits within equality, diversity, and inclusion. It's about being inclusive to your workforce, basically.
Absolutely. Yeah.
And whatever, it doesn't have to be about. Well, I suppose it is a protected characteristic if it's a disability, but people don't necessarily recognise that. But and
I think that's the problem. It's hidden disability.
Yeah.
Everybody in the workplace could have cancer and nobody would know. And I think it's almost empowering your workforce to say, if you have cancer, did you know you are legally disabled in the UK and we cannot discriminate against you and we have to make reasonable adjustments?
Yeah. And remember, it's not just while you're sick, it's for the rest of your life.
If you had cancer when you were 5, you are still legally disabled for life.
Wow. Okay.
Just because you finish cancer treatment for 2 weeks, if you have a wobble and it's related to cancer 10 years down the line, that is still included.
That's an interesting one. What if, sorry, this is a bit of a devil's advocate question. If you haven't disclosed that you've got cancer and the company makes you...
They can't help you.
Right, so you haven't accepted unless you've told the company.
Yeah. So you're only required, you're not legally required to disclose your cancer, but there is case law that employers are supposed to be intelligent and informed about their employees. Therefore, for example, if somebody's been having lots of sickness appointments, generally unwell, it's their duty to understand what's been going on, so that if they do have cancer or another chronic illness, as it were, that they can make the adjustments that are necessary. So non-disclosure is not necessarily an excuse for ignorance, if you see what I mean, on the part of the employer.
And having processes like return to work interviews in terms of sickness and things like that would help pick those things. At least you're doing what you can to
Exactly.
I mean, the point about the fact that they're legally protected is great, obviously, but I would hope as a caring organisation and looking at wellbeing and values, you would want to say, the law protects you, but the most important thing is we value you and we want to support you. And that's you want it almost linked with the values, linked with ED&I, but just getting it out there to try and make it less stigmatised. Like in the same way as we've said earlier, things like menopause and mental illness are in the workplace becoming less stigmatised. Thank you so much for a really powerful podcast episode. If people want to reach out to either of you as individuals, I'll give you a moment to maybe just say how they can get hold of you, and equally if they want to find out more of the resources or find out more, we will put links. But if you'd like to just say Barbara, and then I'll go to you, Liz, as to how people can get in touch with you.
Okay, well, just go to our website, workingwithcancer.co.uk, or contact us via Twitter or LinkedIn. So that's the best way of getting it.
Comes up on Google, doesn't it?
Yeah.
And Liz, my website is liz.o'riordan.co.uk. Again, you can find links to everything there.
And you blog, don't you, as well? So you've got...
Yes, I had a blog and I put videos on Instagram talking about this kind of thing, just to empower the general public so they know what their rights are.
Yes. So there's also this bit of working with it, but also if there's anyone out there listening who is also being treated for it, you've got support there, as I've seen as well, from what you had in terms of your content, haven't you? So really, really powerful. I really appreciate you coming on, and thank you so much for joining us today, and wish you lots of success, and certainly I think this sort of advocating and getting people to pledge is a great idea, and we should put it up there on the agenda. So I hope that this podcast does a little bit towards that too. Thank you
very much.
Thank you.
I really hope you found this week's episode useful and enjoyable. If you did, perhaps you could recommend us to a friend or colleague, or give us a review on your platform of choice. It really helps new listeners to find us. Now you can access links to any of the information mentioned in this show via the website www.hruprising.com. Further free resources are also available at www.actus.co.uk. There you can also find out more about our software and training solutions. Finally, why not join our LinkedIn group, the HR Uprising, to share ideas and collaborate with other like-minded people professionals. Thank you for listening to the HR Uprising podcast.